Question 1. What is the correct protocol for seating a right-handed operator and dental assistant for maximum efficiency and ergonomics? A. Operator at 7 to 9 o'clock, assistant at 1 to 3 o'clock. B. Operator at 10 to 12 o'clock, assistant at 5 to 7 o'clock. C. Operator at 12 to 2 o'clock, assistant at 8 to 10 o'clock. D. Operator at 3 to 5 o'clock, assistant at 7 to 9 o'clock. Answer: A. Operator at 7 to 9 o'clock, assistant at 1 to 3 o'clock. This question tests your foundational knowledge of four-handed dentistry and ergonomic zone placement. The keyword right-handed operator and dental assistant is crucial. For a right-handed operator, the ideal working zone, operator's zone, is typically between 7 and 9 o'clock, allowing direct vision and comfortable reach. The dental assistant zone is then positioned opposite, between 1 and 3 o'clock, for optimal visibility, instrument transfer, and suctioning without interfering with the operator. Maintaining these zones prevents strain and increases efficiency. For example, when setting up for a right-handed dentist, you would position your stool to their left, allowing them to comfortably work from their side. Always remember the clock positions for a right-handed team: operator 7 to 9, assistant 1 to 3. Question 2. Which type of impression tray is used to take impressions of edentulous, toothless, arches? A. Perforated tray. B. Sectional tray. C. Custom tray. D. Stock tray, edentulous. Answer: D. Stock tray, edentulous. This question tests your practical knowledge of impression trays and their specific uses in prosthodontics. The keyword impressions of edentulous, toothless, arches specifies the patient population. Stock trays designed for edentulous arches are available in various sizes and shapes to accommodate the anatomy of a patient's mouth without teeth. While custom trays are often made for final edentulous impressions for greater accuracy, stock edentulous trays are the initial choice for preliminary impressions. Perforated trays are for materials that flow through holes, and sectional trays are for specific parts of the arch with teeth. For example, before making a full denture, the dentist would take a preliminary impression using a stock edentulous tray. Always remember that for toothless arches, you use an edentulous stock tray. Question 3. What is the standard term for the procedure involving the removal of only the coronal portion of a vital pulp in a primary tooth, leaving the radicular pulp intact? A. Pulpectomy. B. Root canal therapy. C. Pulp capping. D. Pulpotomy. Answer: D. Pulpotomy. This question tests your understanding of specific endodontic procedures, particularly in pediatric dentistry. The keywords removal of only the coronal portion of a vital pulp and primary tooth, leaving the radicular pulp intact, precisely define a pulpotomy. This procedure is performed to preserve the vitality of the remaining root pulp and allow the tooth to complete its natural exfoliation. Pulpectomy or root canal therapy involves complete pulp removal, and pulp capping is for exposed pulp. For example, if a child's deep cavity reaches the pulp chamber but not the root canals, a pulpotomy is often the treatment of choice. Always remember that a pulpotomy is about keeping the root pulp alive in a baby tooth. Question 4. In the universal numbering system, what is the number for the permanent mandibular left first premolar? A. Number 12. B. Number 13. C. Number 20. D. Number 21. Answer: C. Number 20. This question evaluates your essential knowledge of the universal numbering system, which is fundamental for accurate communication and charting in dentistry. The keyword permanent mandibular left first premolar specifies a unique tooth. In the universal numbering system, permanent teeth are numbered 1 through 32, starting with the maxillary right third molar, number 1, and moving clockwise around the arches. The permanent mandibular left first premolar is consistently assigned the number 20. Understanding this system is crucial for accurate charting and patient records. For example, if a dentist indicates tooth number 20 needs an extraction, you instantly know which lower left front chewing tooth they are referring to. Memorizing the numbering sequence is a must for all RDAs. Question 5. Which of the following is the most important infection control measure to prevent the transmission of tuberculosis in the dental office? A. Use of a rubber dam for all procedures. B. High-level disinfection of environmental surfaces. C. Postponing elective treatment for symptomatic patients and referral for medical evaluation. D. Routinely sterilizing all handpieces after each patient. Answer: C. Postponing elective treatment for symptomatic patients and referral for medical evaluation. This question assesses your critical knowledge of infection control, specifically for airborne diseases like tuberculosis, TB. The keyword "most important infection control measure to prevent the transmission of tuberculosis" points to source control for highly infectious airborne pathogens. For patients with suspected or confirmed active TB, the most critical step is to postpone elective dental treatment, isolate the patient, e.g., in a private room if treatment is urgent, and immediately refer them for medical evaluation and treatment. This prevents the generation and spread of infectious aerosols within the dental office. While other measures are generally important, they are not specific or sufficient for preventing TB transmission. For example, if a patient presents with a persistent cough, fever, and night sweats, you would alert the dentist and ensure the patient is not treated electively. Always remember that preventing the exposure of active TB is paramount. Question 6. What is the primary function of a liner placed in a deep cavity preparation before the restorative material? A. To chemically bond the restoration to the tooth. B. To reduce polymerization shrinkage. C. To provide thermal insulation and/or pulpal medication. D. To increase the compressive strength of the restoration. Answer: C. To provide thermal insulation and/or pulpal medication. This question tests your detailed understanding of dental materials, specifically the role of liners. The keywords "liner placed in a deep cavity preparation" and "before the restorative material" are crucial clues. Liners are thin layers of material, e.g., calcium hydroxide, glass ionomer, placed in deep preparations to protect the pulp. Their primary functions include providing thermal insulation against temperature changes and, in some cases, delivering therapeutic agents, like calcium hydroxide to stimulate reparative dentin, to the pulp. They are not primarily for bonding, shrinkage reduction, or increasing restoration strength. For example, after the dentist removes deep decay, a small amount of liner might be placed on the pulpal floor before the filling material. Always remember that a liner is like a mini shield or medicine for the pulp in deep cavities. Question 7. The correct position for the film/sensor in a maxillary molar periapical radiograph using the paralleling technique is: A. Angled against the palate to prevent gagging. B. Parallel to the long axis of the molars and positioned towards the midline of the mouth. C. Placed horizontally to capture all molars in one image. D. Tilted distally to avoid superimposition of the zygomatic arch. Answer: B. Parallel to the long axis of the molars and positioned towards the midline of the mouth. This question assesses your precise knowledge of radiographic technique. The keywords maxillary molar periapical radiograph, paralleling technique, and correct position for the film/sensor are critical. In the paralleling technique, the film or sensor must be positioned as parallel as possible to the long axis of the tooth. To achieve this in the maxillary molar region, the film/sensor often needs to be positioned slightly towards the midline of the mouth due to the curvature of the palate, which is then compensated by aiming the X-ray beam parallel to the film. Angling against the palate or tilting distally would cause distortion. For example, you would use a posterior film holder that positions the sensor away from the teeth and towards the center of the mouth. Always remember that for paralleling, the film needs to be as parallel to the tooth as possible, even if it means moving it inwards. Question 8. The purpose of a soft tissue impingement area on a denture is A. To provide additional retention through suction. B. To relieve pressure on sensitive anatomical structures. C. To mark the aesthetic contour of the denture border. D. To allow for expansion of the denture material. Answer: B. To relieve pressure on sensitive anatomical structures. This question tests your detailed understanding of denture design and clinical considerations. The keyword soft tissue impingement is a specific term referring to areas where the denture exerts excessive pressure. Therefore, the purpose often refers to creating relief in such areas. Soft tissue impingement or pressure spots on a denture can cause pain, soreness, and ulcerations. Dentists will often adjust or relieve areas of the denture that impinge on sensitive anatomical structures, e.g., frenum attachments, sharp bony prominences, to prevent discomfort and tissue damage, improving patient comfort and preventing soreness. It's not for retention, aesthetics, or material expansion. For example, if a patient complains of a sore spot under their new denture, the dentist will carefully identify the impingement area and adjust it. Always remember that denture relief is for avoiding painful tissue impingement. Question 9. What is the key difference between a Class II, posterior interproximal, cavity preparation for amalgam versus for composite resin? A. Amalgam preparations are always larger and more conservative. B. Composite preparations typically have a more rounded, conservative design with bevels. C. Amalgam preparations use bonding agents, while composite does not. D. Composite preparations require a higher speed handpiece. Answer: B. Composite preparations typically have a more rounded, conservative design with bevels. This question tests your advanced knowledge of restorative procedures and material-specific preparation designs. The keywords "key difference between a Class II" for amalgam versus for composite resin highlight distinct approaches. Composite resin preparations are typically more conservative, removing less tooth structure, due to their adhesive bonding to enamel and dentin. They often feature rounded internal line angles and external bevels on enamel margins to increase surface area for bonding and improve aesthetics. Amalgam, being mechanically retained, requires specific retentive features like undercuts and typically has sharp internal line angles with no bevels. Amalgam uses bonding agents, but primarily for sealing, not mechanical retention like composite. For example, a composite preparation conserves more healthy tooth structure and has a more flowing, rounded form compared to an amalgam preparation. Always remember, composite preps are more conservative and often beveled, amalgam preps are mechanically retentive with sharp angles. Question 10. Which type of impression material is known for its excellent detail reproduction, hydrophilicity, tolerates moisture, and good tear strength, but can be difficult to remove from undercuts due to its stiffness? A. Polysulfide. B. Polyether. C. Vinyl polysiloxane, VPS. D. Condensation silicone. Answer: B. Polyether. This question assesses your in-depth knowledge of elastomeric impression materials, which is crucial for selecting the right material for specific clinical situations. The keywords excellent dimensional stability, hydrophilicity, and good tear strength are positive attributes, but the crucial negative characteristic difficult to remove from undercuts due to its stiffness is a classic description of polyether impression material. Polyethers are known for their stiffness once set, making them challenging to remove from areas like interproximal undercuts without tearing the impression or potentially dislodging teeth. Polysulfides have an odor but less stability. VPS, silicone, is generally more hydrophobic, and condensation silicone has less dimensional stability. For example, a dentist might choose polyether for an impression of a crown preparation because of its accuracy, but must be mindful of its stiffness when removing it from the mouth. Always remember that polyether's strength and accuracy come with the trade-off of its distinct stiffness. Question 11. What is the most critical factor influencing the long-term success of an endodontically treated tooth restored with a post and core and a full coverage crown? A. Patient's age. B. The type of post material, e.g., fiber versus cast metal. C. Presence of a ferrule. D. Size of the periapical lesion. Answer: C. Presence of a ferrule. This question delves into the advanced restorative considerations for root canal-treated teeth. The keywords long-term success, endodontically treated tooth, post and core, and full coverage crown point to structural integrity. The ferrule effect is considered the most critical factor for the long-term success of these restorations. A ferrule is a band of sound tooth structure, at least 1.5 to 2 mm in height, encircling the tooth preparation, extending coronally from the margin of the crown. It provides a hoop effect that resists fracture of the root, especially when combined with a post and core. While post material and lesion size are important, the ferrule provides crucial structural integrity. For example, if a tooth has insufficient remaining tooth structure above the bone, it might not be a good candidate for a post and core with a crown because a ferrule cannot be achieved. Always remember that the ferrule is like a seatbelt for the root, preventing fractures. Question 12. Which radiographic technique requires the X-ray beam to be directed perpendicular to the imaginary bisector of the angle formed by the long axis of the tooth and the image receptor? A. Paralleling technique. B. Bisecting angle technique. C. Occlusal technique. D. Panoramic technique. Answer: B. Bisecting angle technique. This question challenges your understanding of specific radiographic techniques, which is crucial for achieving accurate images when standard parallel techniques are not feasible. The concept is the geometric principle of the bisecting angle technique. In this technique, the central ray of the X-ray beam must be directed perpendicular to an imaginary line that bisects, divides in half, the angle formed by the long axis of the tooth and the plane of the image receptor. This specific angulation minimizes distortion and helps produce an image that is approximately the same length as the actual tooth. The paralleling technique uses parallel film/tooth and perpendicular beam. For example, when taking a periapical of a patient with a shallow palate, the film might not be parallel to the tooth, so the bisecting angle technique is used to compensate. Always remember that the bisector is the key to correct angulation in the bisecting angle technique. Question 13. Which class of motion involves movement of the entire arm and shoulder, such as reaching for items stored in a distant drawer? A. Class 1. B. Class 2. C. Class 3. D. Class 4. Answer: D. Class 4. This question tests your detailed understanding of motion economy and ergonomics in the dental operatory. The keyword movement of the entire arm and shoulder and reaching for items stored in a distant drawer describe Class 4 motion. Class 4 motions are considered less efficient and more fatiguing than Class 1, 2, or 3 motions because they involve larger movements of the torso and limbs. The goal in four-handed dentistry is to minimize these types of motions to reduce operator and assistant fatigue. Class 1 is fingers, Class 2 is fingers and wrist, Class 3 is fingers, wrist, and elbow. For example, consistently reaching across the patient for supplies that aren't in your immediate zone is a Class 4 motion and should be avoided. Always remember that Class 4 motions involve big arm and shoulder movements, which means more work. Question 14. What is the normal reading range for an adult patient's oral temperature? A. 35.0 to 36.0 degrees Celsius, 95.0 to 96.8 degrees Fahrenheit. B. 36.1 to 37.5 degrees Celsius, 97.0 to 99.5 degrees Fahrenheit. C. 37.6 to 38.5 degrees Celsius, 99.7 to 101.3 degrees Fahrenheit. D. Above 38.5 degrees Celsius, 101.3 degrees Fahrenheit. Answer B. 36.1 to 37.5 degrees Celsius, 97.0 to 99.5 degrees Fahrenheit. This question assesses your essential knowledge of vital signs, a fundamental aspect of patient assessment. The keyword normal reading range for an adult patient's oral temperature refers to a standard physiological parameter. A healthy adult's oral temperature typically falls within the range of 36.1 degrees Celsius to 37.5 degrees Celsius, 97.0 degrees Fahrenheit to 99.5 degrees Fahrenheit. Temperatures outside this range can indicate fever, pyrexia, or hypothermia and may warrant further medical evaluation or treatment modification. For example, when taking a patient's vital signs, a reading of 98.6 degrees Fahrenheit 37 degrees Celsius is a common healthy temperature. Always remember that approximately 97 to 99.5 degrees Fahrenheit is the normal range for oral temperature. Question 15. The most common cause of root canal treatment failure that necessitates retreatment or extraction is A. Patient noncompliance with oral hygiene. B. Incomplete cleaning or obturation, filling, of the root canal system. C. External root resorption. D. Allergic reaction to root canal materials. Answer B. Incomplete cleaning or obturation, filling, of the root canal system. This question assesses your understanding of the complexities of endodontic treatment and common reasons for its failure. The keywords most common cause of root canal treatment failure point to a primary technical issue. The most frequent reason for root canal treatment failure is the incomplete cleaning, shaping, or obturation, filling, of the root canal system, which allows bacteria to persist and reinfect the area. This can happen due to missed canals, insufficient removal of infected tissue, or voids in the filling material. While patient compliance, resorption, and allergies can be factors, residual infection due to inadequate treatment is overwhelmingly the leading cause of failure. For example, if a radiograph after a root canal shows a dark area around the root tip months later, it often indicates persistent infection due to an incompletely sealed canal. Always remember that thorough cleaning and filling of all canals are paramount for root canal success. Question 16. What is the primary method for sterilizing heat-tolerant dental instruments that penetrate soft tissue or bone? A. High-level disinfection. B. Intermediate-level disinfection. C. Autoclaving. D. Chemical germicides. Answer C. Autoclaving. This question tests your foundational knowledge of infection control, specifically the most effective method for sterilizing critical instruments. The keywords heat-tolerant and penetrate soft tissue or bone define critical instruments, which must be fully sterilized. Autoclaving uses steam under pressure to destroy all microorganisms, including bacterial spores, making it the gold standard for sterilizing heat-stable instruments like surgical forceps or burrs. Disinfection methods, even high-level, do not reliably kill all spores and are therefore insufficient for critical items. For example, after a tooth extraction, all surgical instruments used would be processed and then sterilized in an autoclave. Always remember that for instruments that enter sterile body areas, sterilization is the only acceptable method. Question 17. Which of the following is the most critical step in preventing cross-contamination from dental impressions sent to the laboratory? A. Rinsing with cold water only. B. Disinfecting the impression before sending. C. Wrapping in a wet paper towel. D. Storing in a sealed bag without prior treatment. Answer B. Disinfecting the impression before sending. This question tests your critical knowledge of infection control protocols for handling laboratory items. The concept is preventing the spread of pathogens from the patient's mouth to the dental laboratory. The most critical step is to disinfect the impression thoroughly with an appropriate agent before it leaves the operatory and is sent to the lab. This eliminates microorganisms that could contaminate laboratory personnel or equipment. Rinsing alone is insufficient, and simply wrapping or bagging a contaminated impression would allow pathogens to spread. For example, after taking an alginate impression, you would rinse it, spray it with a disinfectant, and then place it in a biohazard bag for transport. Always remember to disinfect all impressions before they leave the clinical area. Question 18. What is the proper method for disposing of contaminated sharps, such as needles or scalpel blades? A. Place in a biohazard bag. B. Recap and place in regular trash. C. Immediately place in a puncture-resistant sharps container. D. Disinfect and reuse. Answer: C. Immediately place in a puncture-resistant sharps container. This question assesses your crucial knowledge of sharps safety and infection control protocols. The keyword disposing of contaminated sharps is critical. According to OSHA guidelines, all contaminated sharps, including needles, scalpel blades, and burrs, must be immediately placed into an appropriate, puncture-resistant sharps container at the point of use. Recapping needles using a two-handed technique is strictly prohibited due to the high risk of needle stick injury. Sharps should never go into regular trash or biohazard bags. For example, after an injection, the dental assistant would immediately drop the uncapped needle into the nearby sharps container. Always remember, sharps go directly and uncapped into the sharps container. Question 19. When working chairside, the dental assistant's field of operation is commonly referred to as the A. Operator's zone. B. Static zone. C. Assistant zone. D. Transfer zone. Answer: C. Assistant zone. This question tests your knowledge of four-handed dentistry principles and ergonomic zones, which is crucial for efficient and comfortable teamwork. The keyword dental assistant's field of operation points to their designated area. The assistant zone is the area where the dental assistant is seated and performs their duties, typically from 2 to 4 o'clock, for a right-handed operator. This zone allows optimal access to instruments, suction, and patient without interfering with the operator. The operator's zone is for the dentist, the transfer zone is for instrument exchange, and the static zone holds less frequently used items. For example, you would position your stool and tray so that all your instruments and suction are easily accessible within your assistance zone. Always remember that the assistance zone is your personal space for efficient teamwork. Question 20. The primary goal of coronal polishing performed by an RDA is to A. Remove calculus. B. Remove plaque and extrinsic stains. C. Harden enamel. D. Desensitize teeth. Answer: B. Remove plaque and extrinsic stains. This question assesses your understanding of the scope and purpose of coronal polishing, a common RDA duty. The concept is the specific objective of this procedure. Coronal polishing is primarily performed to remove soft deposits like plaque and extrinsic stains, those on the outer surface of the enamel, such as from coffee or tobacco, from the clinical crowns of teeth. It is important to note that RDAs are typically not permitted to remove calculus, hardened plaque, which requires scaling by a dentist or hygienist. Polishing does not harden enamel or directly desensitize teeth. For example, after scaling, a hygienist or RDA would use a prophy angle with paste to polish away any remaining soft deposits and stains. Always remember that coronal polishing targets the soft stuff and surface stains, not the hard calculus. Question 21. Which dental material is known for its excellent strength, wear resistance, and long-term durability, but is not aesthetically pleasing due to its silver color? A. Composite resin. B. Glass ionomer. C. Amalgam. D. Ceramic. Answer: C. Amalgam. This question assesses your knowledge of common restorative materials and their key characteristics. The keywords excellent strength, wear resistance, and long-term durability, but not aesthetically pleasing due to its silver color, are classic descriptors of amalgam. Amalgam has been a reliable restorative material for decades, known for its robustness, especially in posterior teeth where chewing forces are high. However, its metallic silver appearance is a significant drawback in today's aesthetic-conscious dentistry. Composite resin and ceramic are tooth-colored, and glass ionomer is tooth-colored but weaker. For example, a dentist might recommend amalgam for a large filling on a back molar if aesthetics aren't a concern for the patient. Always remember that amalgam is strong and long-lasting, but it's not tooth-colored. Question 22. What is the process of mixing liquid mercury with an amalgam alloy powder called? A. Condensation. B. Polymerization. C. Trituration. D. Setting. Answer: C. Trituration. This question tests your practical knowledge of dental materials, specifically the preparation of amalgam. The keyword mixing liquid mercury with an amalgam alloy powder refers to a specific process. Trituration is the mechanical mixing of the predosed mercury and amalgam alloy in an amalgamator. This process initiates the chemical reaction that allows the amalgam to set, harden. Condensation is packing, polymerization is hardening for composites, and setting is the overall hardening process. For example, before handing the amalgam carrier to the dentist, you would triturate the capsule until it reaches a shiny, homogeneous consistency. Always remember that trituration is the vital step to combine mercury and alloy. Question 23. What is the standard classification system used to classify the mobility of a tooth? A. G.V. Black's classification. B. Class 1, 2, 3 mobility scale. C. Miller classification of recession. D. Who Basic Screening Survey. Answer: B. Class 1, 2, 3 mobility scale. This question assesses your knowledge of basic periodontal charting and diagnostic terminology. The keyword classify the mobility of a tooth points to a specific clinical assessment. Tooth mobility is classified using a standard scale of Class 1, Class 2, or Class 3. Class 1 indicates slight mobility, Class 2 moderate, and Class 3 severe mobility, often with vertical or horizontal displacement. This classification helps assess the health of the periodontal ligament and supporting bone. G.V. Black's is for cavities, Miller for recession, and Who for surveys. For example, if a tooth wiggles noticeably with pressure, it might be charted as Class 2 mobility. Always remember that tooth mobility is categorized using the 1, 2, 3 scale. Question 24. Which of the following is an example of an expanded function that an RDA may legally perform only after receiving specific training and certification? A. Exposing dental radiographs. B. Taking preliminary alginate impressions. C. Placing and carving amalgam restorations. D. Applying topical fluoride. Answer: C. Placing and carving amalgam restorations. This question tests your critical knowledge of the scope of practice for registered dental assistants, specifically expanded functions. The keywords expanded function and specific training and certification indicate duties beyond basic assisting. Placing and carving amalgam restorations is a common expanded function in many states, requiring specialized training and certification because it involves direct patient care and shaping tooth structure. Exposing radiographs, taking preliminary impressions, and applying topical fluoride are typically considered basic or routine functions for a certified dental assistant without additional expanded duties certification. For example, once certified, an RDA could place a pre-prepared amalgam material into a tooth and shape it under the direct supervision of a dentist. Always remember that expanded functions allow RDAs to perform more advanced clinical procedures, but require specific additional education and licensure. Question 25. Before the dentist injects local anesthetic, what critical step should the RDA ensure the dentist performs to prevent injecting into a blood vessel? A. Recapping the needle. B. Aspirating. C. Wiping the injection site with alcohol. D. Administering nitrous oxide. Answer: B. Aspirating. This question assesses your understanding of local anesthesia administration and patient safety. The keyword "prevent injecting into a blood vessel" points to a vital safety measure. Aspirating means the dentist pulls back slightly on the plunger of the anesthetic syringe before injecting the solution. This action creates negative pressure to check if blood enters the cartridge, indicating the needle tip is inside a blood vessel. If blood is seen, the needle is repositioned, reducing the risk of systemic complications. Recapping is for safety after use, wiping with alcohol is for disinfection, and nitrous oxide is for sedation, not vessel detection. For example, you might observe the dentist perform this aspiration step every time before slowly delivering the anesthetic. Always remember that aspiration is a quick, critical check to ensure the anesthetic is deposited in the correct location, away from blood vessels. Question 26. What is the main purpose of an ultrasonic cleaner in the instrument reprocessing cycle? A. To sterilize instruments. B. To lubricate hinged instruments. C. To loosen and remove debris from instruments before sterilization. D. To dry instruments after washing. Answer: C. To loosen and remove debris from instruments before sterilization. This question assesses your crucial knowledge of instrument processing, specifically the role of an ultrasonic cleaner. The keyword "main purpose of an ultrasonic cleaner" and "before sterilization" are key clues. The ultrasonic cleaner uses sound waves to create microscopic bubbles that implode, cavitation, effectively loosening and removing debris, blood, and tissue from instruments. This pre-cleaning step is vital before sterilization because any remaining organic matter can protect microorganisms from the sterilization process. It does not sterilize, lubricate, or dry instruments. For example, after a procedure, contaminated instruments are placed in the ultrasonic cleaner for several minutes before being rinsed, dried, packaged, and sterilized. Always remember that the ultrasonic cleaner is for getting instruments clean, not sterile. Question 27. The proper sequence for donning, putting on, personal protective equipment, PPE, before a dental procedure is: A. Gloves, mask, eyewear, gown. B. Gown, mask, eyewear, gloves. C. Mask, gown, gloves, eyewear. D. Eyewear, mask, gown, gloves. Answer: B. Gown, mask, eyewear, gloves. This question tests your critical knowledge of infection control protocols, specifically the proper order for putting on PPE to minimize contamination risk. The concept is maintaining aseptic technique. The recommended sequence for donning PPE is: first, put on the gown to protect clothing; second, apply the mask to cover the nose and mouth; third, put on eyewear, goggles or face shield, to protect the eyes; and finally, put on gloves as the last step, as they are the most likely to touch contaminated surfaces and will be removed first. This order helps prevent self-contamination. For example, before assisting with a restorative procedure, you would systematically put on your gown, then mask, then protective eyewear, and finally your gloves. Always remember the order: gown, mask, eyewear, gloves, to ensure proper protection. Question 28. Which type of dental burr is typically used for initial entry into a tooth and removing decay rapidly? A. Finishing burr. B. Diamond burr. C. Round burr. D. Flame burr. Answer: C. Round burr. This question assesses your knowledge of dental burrs and their specific applications in restorative dentistry. The keywords initial entry into a tooth and removing decay rapidly are key indicators for the function of a particular burr. A round burr, with its spherical cutting head, is commonly used for opening the tooth into the dentin, creating retention, and quickly removing soft carious, decayed, dentin. Diamond burrs are abrasive and used for crown preparations, finishing burrs for refining restorations, and flame burrs for specific contouring. For example, after the dentist accesses the enamel with a different burr, they often switch to a round burr to scoop out the soft, infected tooth structure. Remember that round burrs are your go-to for efficiently starting cavity preparations and removing decay. Question 29. What is the common name for tooth number 32 in the universal numbering system? A. Maxillary right third molar. B. Mandibular left first molar. C. Mandibular right third molar. D. Maxillary left second premolar. Answer: C. Mandibular right third molar. This question is a direct test of your essential knowledge of the universal numbering system. The keyword common name for tooth number 32 asks for the specific tooth associated with that number. In the universal numbering system, the numbering begins with the maxillary right third molar, number 1, and proceeds clockwise around the arches to end with the mandibular right third molar, which is always assigned the number 32. Understanding this sequence is crucial for accurate charting and communication. For example, a patient needing wisdom tooth removal in the lower right might have their number 32 extracted. Always remember that tooth number 32 is the last tooth in the lower right corner, the wisdom tooth. Question 30. Which federal agency is responsible for establishing and enforcing workplace safety and health standards, including those related to infection control in the dental office? A. CDC, Centers for Disease Control and Prevention. B. FDA, Food and Drug Administration. C. OSHA, Occupational Safety and Health Administration. D. ADA, American Dental Association. Answer: C. OSHA, Occupational Safety and Health Administration. This question assesses your knowledge of the regulatory landscape in dentistry, specifically identifying the federal agency with enforcement power over workplace safety. The keywords federal agency, establishing and enforcing workplace safety and health standards, and infection control in the dental office are crucial. The Occupational Safety and Health Administration, OSHA, is responsible for creating and enforcing regulations to ensure safe and healthful working conditions for employees, including mandates like the bloodborne pathogens standard that directly impact infection control in dental settings. The CDC provides guidelines, the FDA regulates products, and the ADA is a professional organization. For example, OSHA conducts inspections to ensure dental offices comply with safety regulations. Always remember that OSHA is the enforcement body for workplace safety in dentistry. Question 31. The ALARA principle in dental radiography stands for: A. Always limit all radiation always. B. As low as reasonably achievable. C. Allow less and radiograph accordingly. D. Avoiding limited and risky applications. Answer: B. As low as reasonably achievable. This question tests your essential knowledge of radiation safety principles in dental radiography. The acronym ALARA is a fundamental concept for minimizing patient and operator exposure to radiation. ALARA stands for as low as reasonably achievable, meaning that all reasonable efforts should be made to reduce radiation exposure while still obtaining diagnostic quality images. This principle guides decisions like using lead aprons, thyroid collars, proper film selection, and optimal exposure settings. It's not about always limiting all radiation, but rather being mindful and practical in minimizing it. For example, using digital X-rays instead of traditional film helps adhere to ALARA because digital requires less radiation. Always remember ALARA as your guiding principle for safe radiography. Question 32. What is the primary purpose of a matrix band and retainer system when placing a Class II amalgam restoration? A. To protect adjacent teeth from the amalgam. B. To hold the amalgam in place while it sets. C. To create a temporary wall for the restorative material. D. To provide isolation from saliva and moisture. Answer: C. To create a temporary wall for the restorative material. This question tests your understanding of restorative procedures, specifically the role of matrix systems. The concept is the function of a matrix band during a Class II restoration, which involves the interproximal surface of a posterior tooth. When a cavity extends to the side of a tooth, a matrix band and retainer system is essential to replace the missing tooth wall temporarily. This temporary wall contains the restorative material, like amalgam, and helps shape it to restore the natural contour of the tooth, ensuring proper contact with the adjacent tooth. It does not primarily protect adjacent teeth, though it helps hold amalgam during setting, which requires condensation, or isolate from moisture, which is done by a rubber dam. For instance, without a matrix band, the amalgam would simply spill into the space between teeth. Always remember that the matrix band acts as a crucial temporary wall for building up the tooth. Question 33. When taking an alginate impression, which action helps to prevent gagging in a patient? A. Having the patient breathe through their nose. B. Tilting the patient's head back slightly. C. Placing the tray with excessive material. D. Instructing the patient to swallow frequently. Answer: A. Having the patient breathe through their nose. This question tests your knowledge of patient management during impression taking, focusing on comfort and preventing a common issue. The keyword prevent gagging highlights the need for strategies to make the procedure tolerable. Encouraging the patient to breathe deeply and slowly through their nose helps distract them and creates a sensation of control, which significantly reduces the gag reflex. Tilting the head forward, not back, can also help, and using excessive material or frequent swallowing would likely worsen the gag reflex. For instance, before inserting the tray, you might tell the patient, "Just focus on breathing slowly through your nose, and you'll do great." A helpful tip is that distraction and control are often key to managing patient anxiety during procedures. Question 34. What is the typical amount of time a topical anesthetic should remain on the oral mucosa to be effective? A. 10 to 15 seconds. B. 30 seconds to 1 minute. C. 2 to 5 minutes. D. 10 minutes. Answer: C. 2 to 5 minutes. This question assesses your practical knowledge of administering topical anesthetics. The concept being tested is the proper application and dwell time for topical agents. To allow sufficient time for the anesthetic to penetrate the surface tissues and numb the area effectively before an injection, topical agents generally need to remain on the oral mucosa for 2 to 5 minutes. Applying it for too short a time, e.g., 30 seconds, will not provide adequate numbing, while leaving it on for an excessively long time, e.g., 10 minutes, is usually unnecessary and offers no additional benefit. For instance, if the dentist needs to numb a specific area before administering local anesthetic, the RDA would apply topical gel with a cotton swab and wait the recommended time. Remember that patience is key for effective topical anesthesia. Question 35. When mixing alginate for an impression, how should the powder be added to the water? A. Pour all the powder into the water at once. B. Gradually sprinkle the powder into the water. C. Add water to the powder in small increments. D. Mix the water and powder separately before combining. Answer: B. Gradually sprinkle the powder into the water. This question assesses your practical knowledge of dental materials, specifically the proper technique for mixing alginate impression material. The concept is achieving a smooth, homogeneous mix. The correct method is to gradually sprinkle the alginate powder into the measured water. This technique allows the powder to become fully saturated and reduces the formation of air bubbles or dry spots, which can lead to a grainy mix and inaccurate impressions. Pouring all at once or adding water to powder can result in lumps. For example, while stirring the water in the mixing bowl, slowly sift in the powder until it's all incorporated before vigorously spatulating. Remember, a smooth mix starts with how you add the powder to the water. Question 36. What is the recommended type of water to use in a steam autoclave? A. Tap water. B. Distilled or deionized water. C. Sterilized saline. D. Bottled drinking water. Answer: B. Distilled or deionized water. This question tests your critical knowledge of sterilization equipment maintenance and longevity. The keyword recommended type of water to use in a steam autoclave refers to a specific requirement. Autoclaves require distilled or deionized water to operate properly and prevent damage. Tap water contains minerals and impurities that can cause scaling, corrosion, and residue buildup inside the autoclave chamber and on instruments, leading to malfunction and ineffective sterilization. Using purified water maintains the integrity of the unit and ensures proper steam quality. For example, you would always refill the autoclave's reservoir with distilled water each morning. Always remember that distilled or deionized water is essential for your autoclave's health and effective sterilization. Question 37. Which of the following conditions might necessitate the use of an antibiotic prophylaxis before certain dental procedures? A. Gingivitis. B. Recent history of a fractured tooth. C. Prosthetic cardiac valve. D. Mild dental anxiety. Answer: C. Prosthetic cardiac valve. This question assesses your knowledge of medical considerations in dentistry, specifically when antibiotic prophylaxis is required. The concept is preventing infective endocarditis. A prosthetic cardiac valve is a significant medical condition that places a patient at high risk for infective endocarditis, a serious infection of the heart lining or valves. Therefore, these patients are typically prescribed antibiotics before certain dental procedures that could release bacteria into the bloodstream, preventing those bacteria from colonizing the prosthetic valve. Gingivitis, a fractured tooth, or mild anxiety do not warrant antibiotic prophylaxis. For example, a patient with an artificial heart valve would take antibiotics an hour before a dental cleaning or extraction. Always remember that antibiotic prophylaxis is a critical step for patients with specific high-risk heart conditions. Question 38. The general rule for operator and assistant positioning is that the assistant should be seated how many inches higher than the operator? A. 1 to 2 inches. B. 4 to 6 inches. C. 8 to 10 inches. D. 10 to 12 inches. Answer: B. 4 to 6 inches. This question tests your knowledge of ergonomic positioning in four-handed dentistry, which is essential for comfort, visibility, and preventing musculoskeletal issues. The concept is ideal height difference between the operator and assistant. The dental assistant's stool should typically be positioned 4 to 6 inches higher than the operator's stool. This elevated position allows the assistant to have a clear view of the operating field and to effectively anticipate the operator's needs without straining. Proper height difference ensures optimal vision and comfortable posture for both team members. For example, before a procedure, you would adjust your stool so you are slightly higher than the dentist, looking over their shoulder into the mouth. Always remember that being slightly higher, 4 to 6 inches, gives you the best view. Question 39. What is the primary function of a temporary restorative material placed after a tooth preparation, before the permanent restoration is ready? A. To provide a definitive, long-lasting seal. B. To allow the tooth to self-cleanse more easily. C. To protect the pulp, prevent sensitivity, and maintain tooth position. D. To promote rapid healing of deep carious lesions. Answer: C. To protect the pulp, prevent sensitivity, and maintain tooth position. This question assesses your understanding of temporary restorations and their clinical importance. The keyword primary function of a temporary restorative material highlights its crucial, multifaceted role. A temporary filling or crown is placed to protect the tooth's pulp from further irritation, thermal, chemical, bacterial, reduce postoperative sensitivity, and maintain the position of the tooth in the arch, preventing adjacent teeth from shifting or the opposing tooth from supererupting. It is not meant to be definitive or to self-cleanse, and while it aids healing by protecting the pulp, that's not its direct primary function. For example, if a patient needs a permanent crown, a temporary crown is essential to keep the tooth safe and functional until the lab-fabricated crown is ready. Always remember that temporary restorations are multitaskers for protection and maintenance. Question 40. When preparing a gypsum model, what is the purpose of adding specific amounts of water to the powder? A. To control the color of the final model. B. To achieve the correct consistency and strength of the stone. C. To accelerate the setting time significantly. D. To increase the working time for manipulation. Answer: B. To achieve the correct consistency and strength of the stone. This question tests your practical knowledge of dental materials, specifically gypsum manipulation. The keyword purpose of adding specific amounts of water to the powder highlights the importance of the water-to-powder ratio. Adding the precise, recommended amount of water to gypsum powder is critical for achieving the ideal consistency for pouring, as well as ensuring the final model has optimal strength, hardness, and dimensional accuracy. Too much water makes it weak, too little makes it too thick to pour properly. It primarily impacts consistency and strength, not color, or significantly altering setting/working time beyond recommended ranges. For example, when mixing stone for a model, you would carefully measure both the powder and water according to the manufacturer's instructions to get a perfect mix. Always remember that the correct water-to-powder ratio is vital for a strong, accurate gypsum model. Question 41. The condition characterized by grinding or clenching of teeth, often unconsciously, especially during sleep, is known as A. Erosion. B. Abrasion. C. Bruxism. D. Attrition. Answer: C. Bruxism. This question tests your understanding of common oral habits and their associated terminology. The keywords grinding or clenching of teeth, unconsciously, and especially during sleep directly describe bruxism. Bruxism is a parafunctional habit that can lead to excessive tooth wear, attrition, muscle pain, and temporomandibular joint (TMJ) problems. Erosion is tooth loss from acid, abrasion is from mechanical forces like aggressive brushing, and attrition is tooth wear from tooth-to-tooth contact, often a result of bruxism. For example, if a patient wakes up with a sore jaw and their teeth appear flattened, they likely have bruxism. Always remember that bruxism is the subconscious grinding or clenching of teeth. Question 42. What is the main reason for placing a rubber dam during restorative procedures? A. To keep the patient's mouth open comfortably. B. To protect the patient's airway from small objects. C. To isolate the operating field from saliva and moisture. D. To provide a clear field of vision for the operator. Answer: C. To isolate the operating field from saliva and moisture. This question tests your crucial knowledge of isolation techniques in restorative dentistry. The keyword main reason for placing a rubber dam points to its primary benefit. The dental dam creates a barrier that completely isolates the tooth or teeth being worked on from the rest of the oral cavity. This provides a dry, clean operating field free from saliva, blood, and other contaminants, which is essential for the success and longevity of many dental materials, especially composites. While it also helps with airway protection and visibility, its primary role is moisture control. For example, before placing a composite filling, the dentist typically asks for a rubber dam to ensure the tooth stays perfectly dry. Always remember that the rubber dam's main job is to create a super dry, clean working area. Question 43. Which type of impression material is known for its excellent detail reproduction, hydrophobicity, repels water, and is often used for final impressions for indirect restorations? A. Alginate. B. Polyether. C. Vinyl polysiloxane, VPS. D. Agar. Answer: C. Vinyl polysiloxane, VPS. This question tests your detailed knowledge of elastomeric impression materials. The keywords excellent detail reproduction, hydrophobicity, repels water, and final impressions for indirect restorations are key characteristics of vinyl polysiloxane, VPS, also known as addition silicone. VPS is highly accurate, dimensionally stable, and widely used for precise final impressions for crowns, bridges, and inlays/onlays. While polyether is also accurate and hydrophilic, VPS is known for its hydrophobic nature, though newer formulations are more hydrophilic. Alginate and agar are hydrocolloids. For example, a dentist would use VPS to capture fine details of a crown preparation for the dental lab. Always remember that VPS is your high-accuracy, detail-capturing material for final restorations. Question 44. The use of a topical fluoride gel or varnish is an example of which type of preventive dentistry? A. Primary prevention. B. Secondary prevention. C. Tertiary prevention. D. Restorative prevention. Answer: A. Primary prevention. This question assesses your understanding of the levels of preventive dentistry. The keyword topical fluoride gel or varnish and type of preventive dentistry are key clues. Primary prevention involves measures taken before a disease or condition occurs to prevent its onset. Applying topical fluoride is a prime example, as it strengthens enamel and helps prevent cavities from ever forming. Secondary prevention focuses on early detection and treatment to stop disease progression, e.g., filling a small cavity, and tertiary prevention involves managing an established disease to minimize complications and restore function, e.g., crown for a badly decayed tooth. For example, sealants and regular cleanings are also forms of primary prevention. Always remember that primary prevention aims to stop problems before they even start. Question 45. What is the common name for the smallest, most commonly used instrument in the basic setup, used to grasp and transfer small items? A. Mouth mirror. B. Explorer. C. Cotton pliers. D. Periodontal probe. Answer: C. Cotton pliers. This question tests your fundamental knowledge of basic dental instruments. The keywords smallest, most commonly used instrument in the basic setup and grasp and transfer small items are definitive clues. Cotton pliers, also known as pickup pliers or dressing pliers, are a standard part of every basic setup. Their primary function is to grasp, transfer, and retrieve small items like cotton rolls, pellets, or articulating paper from the instrument tray to the patient's mouth. A mouth mirror is for vision, an explorer detects decay, and a periodontal probe measures pockets. For example, you would use cotton pliers to pass a fresh cotton roll to the dentist. Always remember that cotton pliers are your versatile grab-and-go tool for small items. Question 46. According to HIPAA, what is the term for a patient's health information that is identifiable and protected by law? A. Public health information, PHI. B. Sensitive medical records, SMR. C. Protected health information, PHI. D. Confidential patient data, CPD. Answer: C. Protected health information, PHI. This question assesses your critical knowledge of HIPAA regulations, a fundamental legal concept in patient privacy. The keyword patient's health information that is identifiable and protected by law defines the specific term. Under the Health Information Portability and Accountability Act, HIPAA, protected health information, PHI, refers to any individually identifiable health information created, used, or disclosed in the course of providing healthcare. This includes medical records, billing information, and even demographic data that could be used to identify a patient. Understanding PHI is crucial for maintaining patient confidentiality. For example, a patient's name, birth date, and diagnosis, when linked together, constitute PHI. Always remember that PHI is the official term for private patient health data that must be carefully protected. Question 47. Which type of handpiece is primarily used for precision work such as finishing margins, removing decay slowly, and polishing restorations? A. High-speed handpiece. B. Low-speed handpiece. C. Surgical handpiece. D. Fiber optic handpiece. Answer: B. Low-speed handpiece. This question tests your knowledge of dental handpieces and their specific applications. The keywords precision work, finishing margins, removing decay slowly, and polishing restorations are direct clues. The low-speed handpiece, typically operating at 5,000 to 20,000 RPM, provides high torque, rotational force, and precise control. This makes it ideal for tasks requiring careful manipulation, such as refining cavity preparations, removing soft decay, polishing, and laboratory procedures. High-speed handpieces are for rapid cutting, surgical for surgical tasks, and fiber optic refers to light, not speed. For example, after the bulk of a filling is placed, the dentist might use a low-speed handpiece with a finishing burr to smooth the edges. Always remember that the low-speed handpiece is for meticulous, controlled work. Question 48. What is the ideal room temperature range for storing dental impression materials like alginate? A. Below freezing, 0 degrees Celsius per 32 degrees Fahrenheit. B. Room temperature, 18 to 24 degrees Celsius / 65 to 75 degrees Fahrenheit. C. High temperature, above 30 degrees Celsius, 86 degrees Fahrenheit. D. Refrigerated, 2 to 8 degrees Celsius / 36 to 46 degrees Fahrenheit. Answer: B. Room temperature, 18 to 24 degrees Celsius / 65 to 75 degrees Fahrenheit. This question assesses your practical knowledge of dental materials storage, which is crucial for maintaining material integrity and performance. The keyword ideal room temperature range for alginate and other impression materials highlights proper storage conditions. Most dental impression materials, including alginate, are best stored at cool, dry room temperature, approximately 18 to 24 degrees Celsius or 65 to 75 degrees Fahrenheit, away from direct sunlight. Extreme temperatures, especially high heat or humidity, can degrade the material, shorten its shelf life, or alter its setting properties, leading to inaccurate impressions. For example, storing alginate powder in a hot storage closet could cause it to set too quickly and become unusable. Always remember to store your impression materials in a cool, dry place to keep them effective. Question 49. When placing a Class II composite restoration, a mylar strip is primarily used as a matrix to a. Provide a light-blocking barrier for composite. b. Create a temporary wall for the interproximal surface. c. Absorb excess bonding agent. d. Improve visibility of the prepared tooth. Answer: B. Create a temporary wall for the interproximal surface. This question tests your understanding of restorative procedures, specifically the role of matrix systems for composite. The keywords Class II composite restoration and mylar strip as a matrix are specific clues. For Class II composite restorations, which involve the interproximal surface of posterior teeth, a clear mylar strip, or sectional matrix band, is used to create a temporary wall. This wall contains the composite material and helps form the natural contour of the tooth, ensuring a proper contact point with the adjacent tooth and preventing overhangs. Mylar is transparent, allowing the curing light to pass through. It does not block light, absorb bonding agent, or primarily improve visibility. For example, a mylar strip is shaped around the tooth to allow the composite to be packed and shaped accurately on the side of the tooth. Always remember that a matrix strip helps mold the side of the composite filling. Question 50. What is the most common intraoral site for an unexposed or impacted third molar? A. Maxillary anterior region. B. Mandibular anterior region. C. Maxillary posterior region. D. Mandibular posterior region. Answer: D. Mandibular posterior region. This question tests your knowledge of common dental anatomical variations and impaction patterns. The keywords most common intraoral site and unexposed or impacted third molar refer to wisdom teeth that fail to erupt. The mandibular, lower, posterior region, specifically the area of the third molars, is by far the most common site for impacted teeth. This is due to insufficient space in the jaw for the third molars to fully erupt, leading them to become trapped against the second molar or bone. Impacted wisdom teeth often require surgical extraction. For example, panoramic X-rays frequently show lower wisdom teeth impacted against the jawbone. Always remember that lower wisdom teeth are the most likely ones to be impacted.